Chapter 19, page 391, Managing Inventory within the Central Service Department. Learning objectives. As a result of successfully completing this chapter, readers will be able to 1. Explain the importance of inventory management in the healthcare facility. 2. Define the role of central service technicians as it relates to inventory management. 3. Explain basic inventory terms used in healthcare facilities. 4. Explain the cycle of consumable items. 5. Discuss the partnership between central service and materials management. 6. Describe guidelines for handling commercially sterilized packages. 7. Describe common inventory replenishment systems, periodic automatic replenishment level systems, automated supply replenishment systems, exchange cart systems, requisition systems, case cart systems, stat orders. And 8, discuss the role of healthcare facilities in sustainability efforts in the reduction of waste. Introduction. A patient enters the hospital for a surgical procedure. Throughout the admission process, the patient wonders, will the procedure go as planned? Will there be much post-operative pain? How long until I can return home? How long before I'm able to go back to my normal daily activities? The patient does not wonder if the healthcare facility has all the supplies needed for the surgery and post-operative care. The patient trusts that these supplies will be available and trusts in those supplies' availability with his or her life. Providing procedural support requires a vast amount of instrumentation, supplies, and equipment. Every surgery requires both reusable items, such as surgical instruments, as well as disposable or consumable items, such as a suture, bandages, syringes, needles, etc. Failure to provide items needed for patient care and treatment directly impacts patient safety. Therefore, inventory management in the healthcare facility is critically important. It takes a tremendous amount of communication, coordination, and planning to ensure that every patient has every item needed for every procedure. In most facilities, purchasing, receiving, and distribution of supplies is the responsibility of Materials Management Department. To ensure that needs are met at all times, the overall inventory management and distribution process requires input from users and from dispensing areas like central service. CS technicians play an important role in inventory management due to the large number of inventory items that pass through the CS department. Inventory items that arrive in the CS department can be classified under 2 basic categories: operational supplies and patient care supplies. Operational supplies are defined as items needed for the CS department to operate effectively. Examples include detergents, sterilization wrap, and sterilization testing products. Patient care supplies are defined as supplies that will be dispensed for patient treatment and care. Examples include catheters, implants, and bandages. See figure 19.1, which provides an example of products in the basic CS inventory categories. Both supply categories are very important to patient care. It is easy to see how a shortage of patient care supplies would impact patient care. However, it is also important to realize that a shortage of operational supplies would also impact patient care. Imagine trying to provide clean and sterile instruments without detergents or sterilization wrap. Operational supplies defined. Operational supplies. Supplies needed for the operation of the CS department. Examples include detergents, sterilization wraps, sterilization testing products, etc. Patient care supplies defined. Supplies dispensed for patient treatment and care. Examples include catheters, implants, bandages, etc. As discussed in Chapter 1, the scope of service and responsibilities of the CS department varies. Some departments provide supplies for the entire facility. Other CS departments may only provide supplies for surgery. Regardless of the department's scope of service, all CS technicians are involved in the inventory management process in some way. Case cart technicians work with the consumable inventory supplies dispensed for each procedure. Documentation technicians must ensure they have an adequate stock of personal protective equipment and an adequate supply of detergents, disinfectants, brushes, and other decontamination supplies. Instrument assembly technicians must ensure that they have an adequate supply of packaging materials, chemical indicators, package closer supplies, and other assembly supplies. In some cases, they may need to ensure that they have replacement components, such as screws, plates, pins for implant trays. Sterilizer operators must make certain they have sterility assurance tests, such as biological indicators and Bowie-Dick tests. For some types of sterilizers, they must maintain adequate supply of the sterilant. What is inventory? The term inventory has a broad meaning in healthcare facilities. It refers to both reusable and consumable items. Before beginning a discussion about inventory, it is important to become familiar with some key terms and content. There are 3 specific types of inventory in the CS department. Consumable inventory, which includes supplies such as detergents, disposable wraps, and sterility assurance products. Second is reusable inventory items with lower cost, to include items such as transport carts, rigid sterilization containers, and many instruments. And reusable inventory items with a higher cost include items such as mechanical washers and sterilizers. In the healthcare facility, high-cost reusable inventory items are called capital equipment. Consumable items and both higher and lower cost reusable items are considered assets. They represent a significant financial investment by the healthcare facility and must be managed in a way that enables the facility to get the most benefit from them at the lowest cost possible. Consumable inventory has a specific life cycle. It is purchased, stored until used, and replaced. See figure 19.2. This chapter will focus on the management of consumable assets as they relate to the CS department. Definitions. Inventory. Reusable equipment and consumable items used to provide healthcare services for patients. Reusable inventory. Relatively inexpensive assets such as medical devices and sterilization containers that can be reused as healthcare services are provided by patients. Consumable inventory. Assets such as wrapping supplies, processing chemicals, and other items that are consumed or used up as a healthcare facility and services are provided to patients. Capital equipment. Relatively expensive assets such as sterilizers or washers that require significant advanced planning for their purchase. And finally, assets. Something of value that is owned by an organization or person. Conclusion of Chapter 19, Part 1,
Okay,
page 394.
chapter 19, part 1.